This conference will now be recorded.
Okay, we'll start today's class. It's about occupational health, the continuation. So by end of this class, I expect you to learn what is sickness absenteeism, what are the various health problems due to industrialization, and what are the preventive and control measures of occupational diseases that can be grouped under medical measures, engineering measures, and legislative measures. So we'll discuss all these topics in detail in today's class. So first is the sickness absenteeism. What is meant by sickness absenteeism? So it is basically it is a habitual pattern of absence from duty or obligation without good reason. That means the people they keep on getting absent to a duty without any certain reason, like without any good reason of any sickness or anything. It can be any other reasons also. Okay, so it is an important health problem because it impacts the productivity of the work of the working environment, like any factory or anything. Okay, and it is an important useful index of health status of the individual or a worker who works in the factory. Okay, so sickness absenteeism, it is an important useful index of the, it tells the health status, how good are the workers, like how healthy are the workers who are working in the factory. It tells about that. It is an important index. So the incidence of this sickness absenteeism in India is on average of 8 to 10 days per head per year. So on average, an individual can take a leave up to 8 to 10 days. He remains absent without any good reason in per year per person. So that is the incidence rate in our country. So what are the causes of this sickness absenteeism? So it can be not entirely or always due to sickness. As I told you, there won't be any good reason to take the leave. It can be because of any other reasons apart from sickness. Okay, so it is not entirely or always due to sickness. So the causes can be economic causes. So the people under economic causes, usually what happens, some we get some paid leaves. Okay, so to avail that paid leaves, people take sick leave. Okay, some sick leaves are paid, so to they take the privilege of that and they put leaves unnecessarily. So that is the one of the economic cause for sickness absenteeism. Next is the social and family obligations. Especially in our country, people keep on taking leaves for so many other reasons, like social reasons, like any weddings or marriages, any festivals, and to repair of any ancestral houses, and sowing season, like any harvesting season. What happens is people who come to work in cities, okay, the village people, they go back to their villages during that season for sowing and harvesting. So these are the other some of the other reasons for sickness absenteeism. Okay. Next is the medical reasons. These are the actual reasons for the sickness. So those are occupational accidents, any minor occupational accidents, and any respiratory diseases like which are related to respiratory tract because of people who are working in any dust climatic conditions in factories like pneumoconiosis and all, and some GI infections like amoebiasis and gastroenteritis. All these causes can also lead to sickness absenteeism. And the other reasons can be non-occupational. So apart from occupational, other non-occupational causes could be any nutritional disorders like malnutrition, any iron deficiencies, or anything. Okay, and also apart from that, alcoholism. So especially in industrialized cities and all, people are more addicted to alcohol and other addictions like drug addictions. Okay, they also can be remain absent from the work. So these are the various reasons for sickness absenteeism. So sickness absenteeism is basically a short notes for you. So next, coming to the prevention, how can you prevent this sickness absenteeism? It is mainly, it depends on two factors. One is the good proper management skills of the factory, and other thing will be individual at individual levels, the measures what we put. So at factory level, we need good factory management and practices. Like people like the management part of the factory, they should give frequent breaks between the works, and they should like put the people properly for any pre-placement examinations. Like before taking any individual to the work, any worker to the work, adequate pre-placement examination is very much important, because it is like pre-placement examination helps individual to choose for a proper job. So I told you in ergonomics, okay, fitting the right person to a right job. Suppose if an individual has some any health issues related to that particular job, he cannot do. Okay, so we have to do proper pre-placement examination by placing the person in a right work. So that makes the person to feel interesting towards the job, and maintaining of good human relationships, and application of ergonomics. As I told you, what is ergonomics? Ergonomics is nothing but fitting a right person to a right job. So where first you should assess what is his skills and where he can fit to which kind of work. That comes under ergonomics. So these are the various preventive measures for to prevent people taking unnecessary leaves. Okay. Next, because of that, the results will be there will be better utilization of resources, and you can get the maximum production. So you can improve the working production, like the productivity of the factory will be increased by doing these preventive measures. So that's about sickness absenteeism. So next, coming to what are the health problems due to industrialization. So all of you must be knowing these days, like many cities are becoming too much crowded, and urbanization is happening, and too many industries are coming in the cities. Because of that, what happens is there will be lot of health issues, like which are directly or indirectly affecting the individuals like us. Okay, so it can pollute the soil because of industrialization. What happens? A lot of chemicals are used in the industries, so those chemicals are polluting our environment, like soil pollution, air pollution, and water pollution. So all these things can lead to, it's a concern for us because it creates a lot of health problems to the individuals. So let's see what are the health problems which are related to industrialization. So the problems can be environmental sanitation. So because of a lot of industrialization, people are moving to the cities from the villages. So because of that, there will be a lot of overcrowding in the cities, and creating the slums. There are a lot of development of slum areas in the cities. Because of that, there will be improper environmental sanitation, like poor housing conditions, and water and air pollution, and sewage, improper sewage disposal because of too much population in the cities. Okay, and the cities have become congested, and then obviously people are living in very small houses, and the environmental conditions are not as good. Okay, and they also pollute water, air, and also improper sewage disposal causes lot of health problems. And then the communicable diseases. So communicable diseases are mainly because of overcrowding, basically. So as I told you, because there are a lot of slums you could see because of industrialization. So there are a lot of scope for communicable diseases like tuberculosis, sexually transmitted infections, and food and waterborne diseases because of the contamination of the water or food. Okay. Next is food sanitation is getting the standards of food sanitation. Obviously, it gets lower down. And coming to the mental health. So as I told you, many people moving to the cities from the villages because of the work purpose. They cannot get adjust to the city environment. Obviously, they might be have a close connection, and have good relationships in the villages because so many people stay together. When they come to cities, they feel very lonely, and they go into some mental disturbance with the mental condition. So they are like failure to get adjusted at the initial stages. Okay. Next is the accidents. So accidents can be because of congestion or traffic. Obviously, the lot of population is moving around in the cities, that creates a lot of traffic and increased tempo of life. Next are the social problems. Social problems obviously it develops along with the urbanization or industrialization. Those are like consumption of excessive alcohol, addictions to the drugs, prostitution, divorce, crimes, juvenile delinquency, gambling, and broken families. This keeps on increasing. These are the very important social problems which we come across due to urbanization and industrialization. Next is the morbidity and mortality. There will be increasing chances of some of the diseases like chronic bronchitis and carcinoma of lung. Those are the respiratory diseases because of lot of air pollution and all those can lead to these kind of diseases. So these are the various health problems because of industrialization. So coming to the preventive measures, what we can take to prevent and protect these workers from these issues. Okay, so the measures can be proper nutrition, control of communicable diseases, and proper environmental sanitation, and promotion of good mental health, and measures which has to be taken more importantly the vulnerable groups like women and children, and giving good health education, and last and most importantly promotion of family planning services. So these are the measures which we use which we can take to prevent and protect the people, the workers, from those different kinds of health problems due to industrialization. So let's see these things in detail. So nutrition. So malnutrition it contributes to poor health and low work output of the workers. Obviously, when a worker is not taking a good amount of nutrition, so it contributes to poor health of the individual, and in turn it affects the working capacity of the individual. Okay, so this malnutrition has to be taken care of. So according to Indian Factories Act, so in each factory, at least like the factory where they are working with an employees of at least 250 and above, one canteen should be provided. That is must according to Indian Factories Act. So the main aim of this Factories Act is to provide balanced diet and snacks at reasonable cost at every working place, like any factory or any working place. The main aim is to give a balanced diet and snacks at a very reasonable cost, and also educate the individuals or the workers regarding the value of balanced diet. And safe and uncontaminated storage facilities has to be provided those who gets their own food from the house. And also maintaining of sanitary conditions at eating places is utmost important to prevent any foodborne diseases to get any contamination of any food, and that leads to any foodborne diseases. So these are the measures which has to be taken under nutrition. Okay, malnutrition has to be taken care of, and according to Indian Factory Act, one canteen has to be provided for at least like where the employees are working for more than 250 members in a factory, and provision of good balanced diet and snacks at reasonable cost. So these are the important aspects. Next, coming to the control of communicable diseases. As I told you, pre-placement examination, and also another important thing is the periodic examinations that can give a scope to the industry to provide what you call promotion of early diagnosis, treatment, and prevention of diseases and rehabilitation if needed. So periodic health checkups has to keep on doing by the industry to early detection of any diseases, any communicable diseases or anything for early detection and proper treatment and further prevention of those diseases. And in India, especially in India, some of the most important communicable diseases which are common in industry are tuberculosis, typhoid fever, malaria, viral hepatitis, amoebiasis, and venereal diseases. Tuberculosis, because as I told you, pneumoconiosis, like which is related to dust that is produced from the factory, and if any food contamination or that can lead to diseases like typhoid fever and viral hepatitis, and just some GI infections like amoebiasis and venereal diseases. These are the most common communicable diseases. So next, coming to the environmental sanitation. So it is the utmost important to keep the environment clean by using some sanitary measures like supply of good safe drinking water and safe food sanitary food environment and provision of toilets. Okay, at least like one toilet for 25 employees for first 100 members, and then at least one toilet for 50 employees for the next. Okay, so if a factory has more than 100 members, so first 100 members, for first 100 members, at least one toilet for 25 members, and after that, above that, it can be 50 members should share at least one toilet. So that provision has to be made. Next is general plant cleanliness. That means the working, like the plants in the sense. The machines. Okay, so those has to be repainted every 3 years, and it has to keep on getting washed for at least 6 months. And sufficient space. So sufficient space in the sense we have to create sufficient space for the worker to work to prevent from any respiratory tract diseases. If any overcrowding is there, obviously that can lead to respiratory tract diseases. And provision of good lighting, ventilation, and good temperature conditions in the industry, and also protection from against any hazards because of the chemicals that are produced in the industry. And housing is most important because so many people, if the industry doesn't provide any housing conditions, they have to travel from very far. So it is always a good, an industry should provide good housing conditions next to the industry to all the workers who are working in the industries. So these are comes under environmental sanitation. Next is the mental health. So mental health is, as I told you, people come from rural areas. They take a lot of time to get adjust to the city life. Okay, so it is important to promote health and happiness of the workers, and they have to detect the any signs of emotional stress and strain and weed them out at the earliest stage itself, and also and also treating of any mental illness of the employees if needed, and lastly the rehabilitation of the persons who are mentally ill. So these are the measures under mental health. So next is measures for women and children. So these two groups are very vulnerable groups. Okay. So important measures under this are providing maternity leave for 12 weeks and providing maternity benefit under the act called as ESI. Okay. So that act we'll discuss in detail in next slides. And also provision of free antenatal, natal and postnatal services, particularly to the women, okay, who are like carrying. Okay. Next, prohibition of night work between 7 p.m. to 6 a.m. For women and children, and also prevent them to work underground like mines and all. So women and children are not supposed to work underground. Like underground means example like mines and all those things. And their working hours are only between 6 a.m. to 7 p.m. That's it. They are not supposed to work during nights. Okay, and according to Indian Constitution, so no child of less than 14 years can be employed in any factory. That is also another important thing. So these are the measures which are taken care of for women and children. Okay. So next is health education. So health education to the workers who are working in the industry is very much important by creating awareness regarding the basic health need and important health promotional measures. And in industrial settings, it should be envisaged at all levels that. So not only to the individual worker, it is also important to educate people at different levels like management levels and supervisory staff, workers, and trade unions and community. The whole staff has to be educated regarding various aspects in the industry, like what are the hazards, what are the problems they can face because of the machinery, and how to use personal protective measures when they are working, and how they can get prone to accidents. All these aspects should be we should create awareness to all the people who are working in the industries at different levels, and also create awareness regarding personal hygiene. Okay, that is also important thing under health education. So the last one is the family planning. So family planning is recognized as a decisive factor for quality way of life. So it is important measure. A small family norm is always important to get a good quality life. So it is important to encourage the people to adopt the small family norm. So that is the another important measure. Okay, so that's about it. So next we'll move on to what are the how to prevent different occupational diseases. So prevention of occupational diseases. How can we, in generally, we can prevent different occupational diseases. So this is very important question. This is the main question for you. So prevention of occupational diseases can be under these headings. Okay, one is medical measures. So medical measures is nothing but for the individuals. Okay, like taking care of the health, doing periodic examinations, and detection of any diseases at the earliest stage, and creating awareness to the individuals. All this comes under medical measures. Next is engineering measures. So engineering measures are nothing but how to construct it. It's nothing about the factory and the equipments or the machines which we use. Planning of those things in a safer way. That comes under engineering measures. And next is statutory or legislative measures. So legislative measures are nothing but some of the insurance or social security measures which are important for workers who are working in the industries for promotion of good health, and then security. Okay, that comes under statutory or legislative measures. So let's see these measures in detail. So first is the medical measures. So under medical measures, first is pre-placement examination. So pre-placement examination is always very utmost important, because the main purpose of this pre-placement examination is to select the person, the right man to the right job. So that's nothing but application of ergonomics, right? So we have to fit the right person to a right job. For that, we should do, before placing him to a right job, we have to do pre-placement examination. So pre-placement examination has to be done always before employing a person into the job. So it should be done at the time of employment, and the measures can be proper examination of the worker's medical, family, and occupational and social history has to be taken properly, and physical examination, biological examination, and radiological examination. These are the important things which has to be done under replacement examination. And this replacement examination is a useful benchmark for future comparisons. That means when you do replacement examination to a worker, so after giving him a job, over a period of time, we will assess the health condition of the individual. Okay, so how his health condition is after few months or years. Again, we do periodic examinations and we'll compare how his health status is. So that's how it is helpful. Okay, but unfortunately, what happens in countries like India, we don't do replacement examinations that frequently. Okay, which is very rarely done, but it is important to do. Okay, so that's about replacement examination. So next is the periodic examinations. So along with the replacement examination, periodic examinations are also very important, because people get exposed to various health risks, okay, various hazards. Those who are working in industries, because they get exposed to lot of chemicals like dust and fumes, gases, and acids and radiation, all these things, right? So it is very much important very much important to do periodic examination to assess the health status of the worker. So workers examined at least once in a year, especially because what happens is, if you don't do periodic examinations, some of the diseases which develop slowly over the years, So to identify those diseases, it is important to do periodic examinations at least once in a year. That is a normal routine. But for some of the diseases, we even have to do monthly examinations, like those who are working in occupations like dyeing industries or lead or radium industries, where the this radiation and dyes, which are very much hazardous to health. So there we require monthly examinations. Okay. Next, particular care has to be taken for the workers who return from the medical leave, who are on medical leave, and after finishing their medical leave, who comes back to the work. It is important to take care of those individuals and again check them properly, examine properly whether they fit for the job or if they have any other health issues. Okay, so this comes under periodic examination. Next is medical and healthcare services. So it is important to provide continuous medical services like OP services, like OPD services, or any other radiological examinations or any investigations. All these things has to be provided to the worker and his family for free of cost. So these services will be provided under an insurance that is called ESI. Okay. Next is it is also important to provide any first aid services so that this is very utmost important at the industry level because first aid services are important. Those are like immediate services which are available if anything happens suddenly, any accidents happen suddenly in the factory. And also not important, that is immunization services to the children. So these are all comes under medical and healthcare services. Next is notification. So some of the diseases which are related to occupation, those has to be notified because to get the workman's compensation. So those are the diseases. Some of the diseases like 22 diseases which has to be notified, like recognized under Factories Act, and some three diseases are notified and added under Mines Act, and 8 diseases have been notified by DOC regulations. So totally it is 36 diseases which are important, which are related to, which are caused due to various issues due to various what you call people working in different industries, different hazards like caused by people working in different industries. So these diseases I will show you later. So these diseases can what you call, 1 minute, just hold on. Yeah, I come. So these diseases has to be notified because that can create a lot of disability to the worker. So that we and people get compensation for those notifiable diseases in the form of cash or any medical care or anything. Okay, the main aim of this notification is it initiate measures for prevention and protection and effective application and it investigate the working conditions. That means that so once you notify the diseases, so it gives it allows for prevention and protection of the individual for those who get exposed to those diseases, and also it gives scope to investigate the working conditions and further prevention of getting those diseases. That is the main aim of the notification of diseases. So next is supervision of working environment. So that means that periodically inspectors, some people has to keep on monitoring and supervising the working environment where people are working, whether the machine is working properly, whether the what you call the lighting, temperature, ventilation is everything is proper or not. So those things has to be periodically supervised by somebody. Okay, so that will be done by physician. So he is the inspector. He keeps on visiting, he has to give frequent visits to supervise the working environment. So he has to make some checks Okay, so those are like the physician should be acquainted with raw materials, processes, and products which are used in the industries. He keep on checking those things, and also he has to study various aspects of occupational physiology. That means how a person is working in the industry, in that working environment, in that like how he is able to cope up with the work. Personally, he has to check individual worker. Okay. Next, and also he has to enlist the cooperation of safety engineers, individual hygienists, and psychologists. So he can take help of these people, and they have to work all together and prevent any issues if they find out. So this is about supervision of working environment. Next is maintenance and analysis of records. So this is very important. It is to maintain the every health record of every worker, and also the occupational disability records. So suppose some people who may get disabled because of the work. Okay, so it is very important to maintain each and every record of the individual, the worker who works there, and also disability records has to be maintained. So it is essential, it is very important because it is helps to planning, development, and efficient operation of the occupational health services. So it helps to further planning, okay, further planning, and also proper functioning of the industry. Okay, and to watch over health of the workers, and also to assess, devise, or improve the preventive measures. So as I told you, these records helps to to watch over the health of the workers, because as I told you, people get exposed to different conditions in the industry. Some of the diseases can develop slowly. So it is always important to maintain their records and assess their health condition, and also it helps to put some preventive measures. Next is health education and counseling. So health education and counseling is important, and this should start always before you employing a worker into the factory. It explain the correct usage of personal protective devices, like how to use gloves, how to use mask, how to use other personal protective equipments like goggles, aprons, any other things. Okay, it is important to explain them and educate them how to use personal protective devices, and also frequently we have to remind the workers about the dangers in the industry, how the accidents can happen, how to be taken care. All this comes under health education and counseling. So that's about various medical measures. Okay. So next we move on to the engineering measures. So as I told you, engineering measures are nothing but proper designing of the building or the factory, and proper maintaining of the equipments which are used in the industries. So what are these measures? We'll see to prevent the any problems which are related to industries. Okay, so those are like proper designing of the buildings. Okay, so it is very important, and this has to be done at the initial stages, like the blueprint stage of while constructing the industry. And next is the good housekeeping. So good housekeeping is nothing but proper cleanliness of the industry, and provision of good ventilation, lighting, and proper washing and food arrangements has to be done before starting the industry. And next is general ventilation. So general ventilation is nothing but the person has the worker has to get adequate ventilation, adequate lighting for to perform his work, his activity in a better way. So for that, at least a worker should get 5 square feet area, or 500 cubic of airspace has to be provided per person or per worker. And next is the mechanization. So mechanization is nothing but wherever possibility is there. So we can replace the manual work with the machines, like not involving workers too much into the work, where the machine can able to do. So it's better to opt the machinery work than the individual work. So that is called mechanization. Next is the substitution. So substitution is nothing but wherever possibility is there, it is better to substitute the high toxic chemicals with less toxic materials. Suppose an example, the white phosphorus can be replaced with black sulfide, okay, in the matchstick industries, because this white phosphorus can cause a fuzzy job. Okay, so there we can replace. Okay, and some of the chemicals like lead can be replaced with iron. Like that, you have to substitution means it is replacing with something else like better materials than the toxic materials. Next is dust. So dust can be controlled by using wet mopping or by spraying water. Like any wet techniques, we can control the dust. Next, enclosures. So enclosures are nothing but exhaust ventilations. Okay, so we have to provide enclosures wherever the dust is getting coming out. Immediately there we have to place the enclosures. Next is isolation. So isolation is nothing but providing separate buildings for places where a lot of toxic chemicals are getting released. So it's better to provide a separate equipment and separate building for those places. That's called isolation. And local exhaust ventilation. So local exhaust ventilation is nothing but providing a hood or something like that wherever this dust or fumes or gases which are coming out, immediately there itself we have to provide a exhaust ventilation in the form of hood. Okay, that extract the dust which whatever comes out. Okay, that's the local exhaust ventilation. Next is protective devices. Protective devices are nothing but giving respirators. Okay, to prevent a person getting inhaling of that dust particles. Next, environmental monitoring. So environmental monitoring is nothing but periodic surveys and periodic checking of the gases or dust releases from the factories, and check whether those are getting released in a permissible limits or not. So that comes under environmental monitoring. Next is statistical monitoring. So by using like by periodic like frequent collection of data and analyzing it, that helps for further for promotion of further preventive measures and research. So pure research and research for improvement of the manufacturing goods. So that helps for manufacturing of better goods. So research can help. So these are the various measures. So next third one is the legislative measures. So what are the legislative measures? As I told you, these legislative measures are nothing but some of the laws which we use, which we provide for promotion and safety of the workers who are working in the factories. So the factory laws to proven conditions in the industries and safeguard, especially to safeguard the health of the worker is very much important. So it is always important and under the occupational health, that is promotion and maintaining of the health of the worker is utmost important. So these laws are mainly meant for we follow all the Factories Act and the Employees State Insurance Act. That is nothing